Hey, Adam,
Geez,
one
why,
thing.
why do you think they called bumpers scary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that sweet logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
CEWT Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with CEWT Talk.
Hello, everyone. Welcome back to CEWT Talk, our weekly podcast here at Continuing Education and Workforce Training at Idaho State University. I am Paul Dickey. I'm the apprenticeship coordinator here at CEWT. And as always, joining me is Angie Wilhelm, our marketing director. Angie, how are you doing today?
I'm doing really well. It's cold, but very sunny outside, which is super nice for all of us. That it's when you look outside, it looks warm. When you go outside, it's quite deceiving. But we are here as well with our interim director, Raylyn Price, who is making an appearance on just about every one of these. We're so glad to have her as a co-host. So welcome, Raylyn. How are you?
I'm doing great, Angie, and I'm so excited to be here, especially for this podcast, because we have our MC for our emergency medicine conference that's coming up next week. And I just want to introduce you to James Perry. He is a paramedic with Pocatello Fire Department. He is also a co-lead instructor for our EMT class. So we're really excited to welcome James. He's going to be a really super fun MC. I had to twist his arm really a lot to get him here. I've been trying for a few years, but he finally consented. So welcome, James. Do you want to give a little bit more of an introduction?
Sure, yeah. James Perry, I work at the Pocatello Fire Department. I've been there about 21 years and fire captain over there. I've been a paramedic for about 15, going on 16 years. And so yeah, it's been a good career. Been teaching up at ISU at the EMT class for almost, I guess I've been an instructor for about 10 years, teaching up at ISU for about 8.
Wow.
So, what are your hobbies, James?
I was going to say that before we start recording. I found out James is a theater guy, and I'm thinking, really, Raylyn, did you have to twist his arm that much?
I know, right? So I'm that triple threat guy. So no, I sing and dance. I do theater. Woodworking is kind of my thing. I do woodworking. I collect a bunch of like scally caps. Is kind of what I do.
Okay, what's a scally cap?
I should have. Well, these guys.
Okay. All right.
So,
scally cap. I think some people call them a pork pie hat.
75?
Yeah.
I know,
What?
bad, huh?
Wow. So do you display them?
It's my drug.
It's your drag.
There's worse things.
There are
I
worse
have them all
things.
up on my wall, actually, at home. They're all just up on the wall. They each have their hooks, and so just have them up on the wall.
You must
displayed
have
there,
a
so-
very nice wife.
Yeah. She told me I have to have a place to put them if I'm going to keep buying them. I've kind of broken that rule, but
There you go.
My dad did that with his collections. My question though is knowing that if you're a theater person, if you're going to sing the national anthem.
Oh.
Well, that part hasn't even been discussed. I do know it.
Hey,
but,
James.
yeah.
Hey, I'm going to clue you in. No host has ever done it before.
Right?
You would be the
I
first.
don't remember that, but I think I've been to all of them, but yeah. So,
The other
So-
thing I've been trying to twist his arm, they have some very talented musicians at Pocatello Fire Department. I'm just going to put this out here right now. I'm challenging you to put together your band for next year's EMC conference. I want a cool band,
Right.
live music.
We'll have to figure something out because we do have a lot of instrument players,
Oh, you
so drummers
do?
and singers and all kinds of stuff. So
Neat.
Yeah,
Neat.
lots
So-
of talent.
talent at Pocatello Fire.
So James, how long have you been doing emergency medicine?
I started as a volunteer in 2003 with Chubbuck. As a
Okay.
Chubbuck volunteer out there. Went through my EMT class that fall, summer. And then I got hired with Pocatello in 2004 and have been there ever since. So
Wow. So what drew you
Really
to emergency medicine?
well, I guess the long story is I was out, I served a mission for my church and was trying to think of things that I want to do, careers and stuff. And basically I made a list of things, and of the things that I wanted to be on there, I wanted something medical to be able to help people. I wanted something that's not going to be a monotonous job, that's outside, that's physical. Just made my whole list of stuff. And they went to an open house at the fire department, and a guy, one of the medics there, ran into him, and I chatted with him for way longer than I probably should have. I was there with him for probably an hour and a half, 2 hours, just talking about his job. And I took the test the next year and ended up getting hired. So it's pretty
Excellent.
sweet.
So
Excellent.
my question is, how did Ray Lynn convince you to be an instructor for our EMT program?
I think I did.
I think back in the day, one of the other instructors, the lead instructor at the time, he works for the Pocatello Fire Department as well. And I'd heard from him, and he mentioned it one day. I was like, "Oh, that sounds cool. Where are you doing that? How do you get in with that?" And he's like, "Oh, well, just come up to class and we'll get you in." So that's how I started with ISU.
Now,
Yeah,
out of all of the things, like what, because you're a paramedic, you're in fire, you are in education for this as well with our EMT classes, and of course you're going to be our MC at the EMC conference, which you've stated you've attended before. What is, like, out of all of those realms, is there anything in particular that just really hits home and makes you realize why you are doing this? Any particular story or event?
I think the reason why I like what I do is the EMS side. I have a bunch of stories of, like, I guess one specific story, and not getting into the whole details with it all, but ended up basically responded on a guy who had died. His 9-year-old daughter is the one who found him, and just being there for her, just kind of a shoulder to cry on. And even though we weren't able to resuscitate him, being able to be that support for her at that time, and just to be there. My wife has made the comment of, it's weird that you find satisfaction in your job at other people's misfortune, which is true, but at the same, because that's when we get to do our skills, right? But on the other hand, you get to be there for that moral support for those that are having a bad day, and be able to make their day a little better. And that's ultimately, that's what I really like about my job.
Having my son, when he was an infant, stopped breathing, and we had to call 911. And it was so comforting to, of course, he lived, so that was the good thing.
Right.
But to know that you could call a responder, and then the compassion that they showed, and just the professionalism, I guess, just is very comforting, for
Yeah.
And on that, Raylan, years ago, I was in a bad car accident. I was a passenger in a car that rolled, and we were kind of in the sticks a little bit outside of town. And it just so happened that, like, an EMT or a paramedic with the fire department was looking at leaves that same day and was right behind us.
Mm.
And so he was able to stop. And like, I don't remember, I had a head injury, but he stopped in the hospital to say, to check on me once I'd gone up. And we have such an incredible outdoor space in Pocatello, in our surrounding areas, that
We do.
that people are going to get injured, people are going to be in accidents, and we have such a great response from the departments that it's, you don't have to worry about it taking an hour if you're just outside of town for someone to come help you and get you.
Yeah, we have a lot of great people that work for our department and all the departments around us as well. The same thing. Lots of great people that are there. They want to be able to help people and make the world a better place, which is great. Well, like you just mentioned, and your dad was one of those firefighters that did the same thing, Angie. So, which is super cool. But yeah, and as far as transporting and stuff like that, you mentioned as far as time, because Pocatello Fire Department, we run the ambulance service for the county as well. And so we cover the entire county. So we go, 60 miles south on the interstate, and clear out almost to the pass going over to Soda Springs, and then all the county borders. We do all of that area with the ambulance service. And so sometimes you do have a really long transport, because there is lots of places to recreate. Like you said, there's a ton of great things to do around here. And so sometimes you have a long time, and sometimes it's a pretty short transport, but having people that are there and care, can make a difference for your loved ones is sure a good thing.
Well, people who care and who have the training, right? To be able
That's
to
true.
respond to that. So those are things that I really appreciate too. And really one of the biggest reasons that we provide this emergency medicine conference is to help to provide the training. You know what I mean?
Mhm.
To hopefully be able to help to, I guess, supplement what's going on already at your stations.
Yep.
Yeah.
Yeah. And that's the thing with all of our certifications, they require that you have continuing education already. And so to be able to have a conference like this that we can bring to Pocatello is pretty sweet. And have instructors that are doctors and paramedics from other places, and all the different aspects that all of them bring, that we can all learn from is a pretty sweet deal.
Yeah. Yeah, it's been very rewarding, through the
Yeah.
years. It's a lot of work. Don't get me wrong, it's a lot of work, takes a lot of time, but in the end, it's so rewarding when that finally comes together and I see all of those emergency response personnel come in, and our doctors and our nurses, and everybody who's willing to support this event to be able to provide that training. So it's a cool thing.
And on that, Raylan, I'm so glad that I didn't know the EMC was part of this department until I came to work here. And that hits kind of home with what James had said. My dad was a firefighter. And when I was young, he left town to go to some of these trainings because we didn't have one that he could just jump, go on his day off. He had to leave on his 4-day leave and go to Wyoming or go to Utah or go somewhere else to get his credit. So it's so valuable that we have something here in town where area emergency medical services can come and get that training here where they live.
We've been so fortunate to be able to partner with Portneuf on this event, to keep the costs low for our participants. Without our sponsors, we wouldn't be able to do that for such low cost. So glad that we can do that.
So James,
sure.
I have a question. With over 20 years of hindsight, if someone was interested in doing emergency medicine, what would be your biggest piece of advice to them?
Gosh, I guess be fit. And I say that knowing what I look like too. No, but we age and our bodies change. But yeah, be fit. Keep yourself active that you can do things. That's probably the biggest thing. I think, like even myself, I've had my share of injuries. I had a back surgery that was a job thing as well, but I'm back on the job doing my thing that I love to do, and it's sweet that I can do that. It's really a great thing. But just being in it and being active, I think, is the big thing. And even somebody not in my job, the same kind of deal, being active, because that's how you're going to live a long life, right? So we want to be able to have a good long life and take care of yourself, physically, but also mentally. And if you're into that one, spiritually, and all the other stuff too that go with that. So just your whole well-rounded health is super important to take care of yourself.
You know, James, I didn't ever thought about that. I mean, I guess you would have to have some sort of, be sort of physically fit in order to be an EMT. I mean, you've got a lot of physical activity when you're treating someone, don't you?
Yeah, for sure. Obviously, so one of the dad jokes I have in here, it's just stupid. I know that's one of the things that I have in my bio is that I like is the dumb dad jokes, but humorous dad jokes, that's what they are. But what's a paramedic's favorite lift or favorite exercise is the deadlift. Ha ha. It's
I
terrible,
was going to
know,
ask
but
you for a joke, so I'm glad you provided us one.
there's lots of good ones, but yeah, just it is a physically demanding job. Our schedule and a lot of departments I know around in the area have gone to work 2 days in a row. So we work 48 hours straight and then have 96 off. So
Wow.
2 on and 4 days off, which is, to me, I know not everybody loves it, but for me, rather than working day on, day off, day on, day off, day on, and then 4 days off is what we used to have. It, for me, is actually, it's easier to recuperate with that time.
A longer time to charge your batteries.
I know, and that sounds weird because you're working 2 days straight, but at the same time, you're there with everybody at the station. You get to talk and mingle with them and basically be kind of counselors to each other for almost, and help each other through bad things and celebrate the good things. But you have time that you can rest a little bit when we're not training and we're not doing all of our other stuff. But then we can recuperate and actually have time at home and do stuff with our families too. So
excellent.
but yeah, it is a pretty physical job.
So again, not being in the medical field myself, you had that hour-and-a-half conversation. You decided this was the career path that you'd like to go on. What was the most surprising thing once you started this career?
I was a little bit let down that when I started, like, we went in and I'm expecting these big pots in the kitchen that everybody's cooking and having the great big meals all together, right?
Like on emergency, the old emergency TV show.
Right?
Yeah.
Exactly.
Emergency 911.
And we don't all do that. Some crews we do, and we'll take turns in cooking and stuff, but not every crew does that. And I was like, man, that's supposed to be the thing that firefighters eat well all the time.
The bonding experience.
You could start it, James. Just put up like a meal, a task. Everybody has to sign up for a date. And if you don't sign up, you're ordering everybody a meal from whatever restaurant they want.
Oh, they would never do that.
So we do a lot of burritos together and stuff. So we kind of eat together on our crew. Burritos is kind of our thing, but there's a lot of crews that they will get together and they cook their meals and take turns of who's cooking and stuff. But there's not like one chef or whatever. There's not one cook that does all their things. So, but it's a lot of fun. We all do our own thing. But sometimes it's just because of the time that we have. Sometimes you just don't have a lot of time to eat, and it makes it really hard. You get a nice meal cooked and ready to eat, and then the tones go off and, well, I guess we'll come back and eat it when it's all cold. So.
Yeah, there's nobody to clean it up while you're gone.
Yeah, right. I know.
So depending on how long that call is.
Yep, clean up all your own stuff. So yeah.
So James, you mentioned you've been a participant of the Emergency Medical Conference in the past.
Yeah.
What made you enroll and what did you enjoy about the past events that we've had?
Gosh, there has been a variety of things. Like I've done, I think most of the ones that we've had here I've been to. And I really like that there's essentially 3 different or more classes going on all the time. And so you have, usually there's ALS classes that you can go to. They're kind of focused towards more advanced life care. You can do something that's pretty basic. They have the wilderness track. And so like a lot of us around here, we do a lot of outdoor activities. And so to be able to have all of those opportunities to learn from and get our CEUs, because we have to recertify, it's just been a really good opportunity just with that broad range of classes and things that we offer, to make us both better instructors, better responders, providers, all of that stuff. I think it makes us just better. Like last year, for instance, we did a high performance CPR class. And I was part of that class. That was the pre-conference. And that's one of those things, as being a American Heart Association CPR instructor, I think that's made that better. But just better ways to, just better practice to be more effective. That's the words I want.
Excellent. Yeah.
But yeah, just
Excellent.
that wide range of stuff. I really, really enjoy the variety of the classes and the instructors that are there.
Great.
And a
Awesome.
standout one that you can remember, instructor or class? I know that's it's a lot.
There are so many classes that I can think of. The one that first came to my mind, I'll say the Taysums. They did a thing, it might have been last year, it may have been the last one, but they did basically a presentation. They were in Italy on a trip and took care of a guy that was over there. And so their whole thing taking care of him.
Yeah,
as he was having a stroke.
Yeah, I remember that one.
Yeah, that was a good one.
It was a good one.
Yeah.
There's lots and lots of good ones though.
Yeah.
Well, we are reaching time that went by so incredibly fast.
It always does.
As I'm going to actually turn this over to Raylyn as she's kind of heading up the emergency medical conference and our interim director. I'd like to give her a little bit of time to wrap up before it goes to Paul.
I appreciate that. Okay, so one last joke, James.
Yeah.
No pressure.
Why did the pirate want to be an EMT? Because he wanted to do CPR.
I love it. That's good.
That
Thank
one
you,
hurt.
So just one more plug. The Emergency Medicine Conference is next week. Thursday is our pre-conference, which is full. Unfortunately, can't go to that. It's a pre-hospital trauma certification. And then we have on Friday, is it the 7th and the 8th?
The 7th and 8th of
the 7th and 8th. I've got to get my dates straight here. But yes, we're super excited. We've got a great lineup. One that's really unique that we're bringing this year is a 360 presentation from a trauma event that happened in 2021. We're bringing the victim, one of the EMS responders, a life flight nurse, and some trauma surgeons that were there. Wow. And they're going to do a whole 360 look at this situation. So we're so excited for them to come. I know the first responder has not seen the victim since they loaded her in and sent her off. So he's pretty excited to be able to meet her again. So that's one thing. And then we've got a wonderful keynote speaker coming, Kevin Grange, who has just some incredible experience as a paramedic, both civilian and in wilderness. And so we're excited to hear from him. And then so many, I can't even begin to tell you all of the different breakout sessions and wonderful speakers that we have lined up for this event. We shout out to them, that they're willing to come and teach and share that knowledge with other people. And then, of course, our sponsors and vendors that make this possible. So, and donors. So thank you so much to all of you. And we look forward to the Emergency Medicine Conference.
And thank you, James, for being on here. It was
Yes.
so fun getting to chat with you and hear a little bit about your career.
Well, thanks for having me.
Absolutely.
Appreciate it.
Yeah.
I'm looking forward to the conference. It'll be super cool.
Yes.
Excellent.
Thank you.
Excellent. Yes. Thank you, James, for being on today. Raylan, thank you as always. And Angie, can't do this without you. So much appreciated you putting these shows together each week. Now, if anyone wants to check out our other offerings, as well as the registration page for the EMC conference, you can go to our website at cetrain.isu.edu. You can give us an email at cetrain@isu.edu, or you can give us a call at 208-282-3372. Now, this podcast is our way of doing our community outreach and letting people know about events in our community. If you like this podcast, please like, share, subscribe. You know the drill. And as always, be safe out there.